Hello there, it's Dr. Bowser here. This is my second video, and I'm getting a lot of people ringing me up regarding dental emergencies over this coronavirus situation. Obviously, as you know, most dental practices are now closed because obviously the risk of spreading the virus, and we can't practice social distancing from our patients. So hence why we have all kind of decided to close down and give advice over the phone where it's possible. So over the last probably 3 or 4 days, I've had so many people ringing me up regarding their complications, their dental emergencies. So I thought I could do this quick video about how we can help you with some advice with this video. So first thing people ring up obviously is that they're complaining about toothache. Now, obviously, your dentist should be able to provide some kind of an emergency service for you. But if they don't, there's some things you can do at home that may help. First one, obviously, is to take some paracetamol. We recommend 1 gram 4 times a day to alleviate the pain. Now, we have to be very careful and be mindful that with the coronavirus, if you do have it, you're not allowed to take any Nurofen. Purely because it can suppress the temperature. And that's one of the symptoms of the virus, is a very high fever, and we don't want to be able to have any problems where no one can detect if you have a fever. So paracetamol is the safest option to alleviate the toothache in terms of pain. We have offered a remote prescription service, so if there is a swelling around the tooth, we as a practice and as a service to our patients, we have offered the a remote prescription service which is allowed by our practice to do that for you. So if you were in Essex and we had to give you a remote prescription, you could pick up a remote prescription either from your own dentist, who has a relationship with the pharmacist, and they can give you some antibiotics if there is a swelling. Obviously, if there is a swelling, you can't get access to a dentist. There is other things you can do. One of them is to take warm salt mouthwashes. You can use a little bit of salt, warm water, and that helps to alleviate some of the pain or drain the abscess. If you want to drain the abscess, you could use a warm heated needle. I've see people have done that to sterilize and to try and lacerate the abscess to allow some of the pus or the abscess to drain. I know that's a very extreme situation, but we are in extreme circumstances. So, to do anything to alleviate the pain is obviously the main thing. So that's one of the things about toothache. Obviously, keeping good oral hygiene with a fluoride toothpaste is very, very important. You can use the toothpaste as an ointment applied directly onto the tooth, which is a possibility. You can also try and reduce your sugary intake. I know it's when you're at home, there's nothing really much to do besides watch TV and Netflix and chill, as they say. So I would recommend cutting down on the sugary foods. And if you are going to have anything sweet like a drink, maybe drink through a straw. Rather than having it drinking a can of Coke or having any alcohol, just to kind of keep the sugar away from that side of the tooth. So anyway, that's the tip for today. This is my second video blog, just to try and see if we can help any more patients out there regarding any possible toothache. There is another product you can try, which I'm not affiliated with anyway, is oral gel, which is like a topical anesthetic you can apply to the tooth, which may help. Or Bonjela, which is equivalent to that, but it's not as strong as the oral gel. So these are the kind of home remedies you could try to see if it helps. And if there is a problem, obviously your first point of contact is to ring up your dentist, and hopefully they have a medical emergency phone service that they can give you advice over the phone. I hope this helps, and watch for the third video in the series. Take care and stay safe.